this is where we get into hypotheses and theory. And so my best current thinking is that, the brain might look like a mirror image, the left to right of itself, looks symmetric. But, in reality, we know that it's not symmetric. I think the most commonly known example of brain asymmetry is language processing. But there are other functions in the brain that are processed asymmetrically. And so perhaps pain is processed asymmetrically. And there's imaging evidence of this. There was actually a meta-analysis of neuroimaging studies that showed that the right hemisphere appears to be more involved in pain processing than the left. And I don't think that we should be surprised by that. This is asymmetries in the brain are conserved across species, and they're thought to confer evolutionary advantages by preventing duplication of equivalent circuits in the two hemispheres and permitting parallel processing, so improving efficiency. So the other caveat to this thing about pain being processed potentially differently in the brain is that we don't know if our findings of differences between left and right headache and migraine are specific to migraine. For example, there's at least a few published studies that suggest that the left hand is more sensitive to nociceptive stimuli than the right hand. And so it's unclear whether these findings of ours are specific to headache and migraine. So we'll see in the future, hopefully.